we're talking about orthopedics. So students were asked to discuss vertebral fractures. Vertebral fractures. So what are vertebral fractures? Let's quickly talk about. So first of all, you have to know what is the vertebrae. The vertebrae is just another name for the spine. Okay, so you can have fractures there. So we'll go around the causes, talk about the types of vertebral fractures. We'll talk about symptoms, that's issues that patients with spine fractures can face. And we'll talk about the diagnosis, then of course treatment. So vertebral fractures is just a break or collapse in the bones of the spine. Okay, so it's the spine that they call the vertebra. Okay, in technical, so there are actually common types of fractures. They are common especially in older people. So spine fractures are common in older people because loss of bone density. Okay, so their bones are weak. So causes could be osteoporosis, could be traumas, due to all those car accidents, falls, sports injuries. It could be cancer. So tumors spreading to the spine can weaken the spine. Okay, it could be sometimes spinal infections, okay, which is rare. Okay, but if it occurs, it can erode the bone. Now, types of vertebral fractures, we have compression fractures. This one, the vertebra collapses. Okay, it's common in osteoporosis. It collapses. Okay, then burst fractures. This one, the vertebra will just scatter, will burst off. Okay, usually due to high energy trauma, like maybe accidents, car accidents. Then we have the chance fracture, which is caused by violent forward bending. Okay, like you just bend forward all of a sudden. Okay, then we have pathologic fractures, which are you are having fractures due to disease conditions like cancers, infections, and the rest of them. So what are the issues that patients with spine fractures will be facing? They have sudden or severe back pains. The pain usually worsen when they try to use the spine, especially when they want to walk, when they want to stand. And if you ask them that we get to clap them, they tell you that the pain relief when they rest. Okay, so there's loss of height. So that's when osteoporosis mostly comes in. Our mothers over time they start getting short. Neurological symptoms, because a whole lot of nerves network come out from the spine. Okay, so those nerves network could be disrupted. So you're having things like numbness, you're having weakness, you're having paralysis. Okay, so diagnosis, you can use x-rays, you can use CT scans, MRI scans, then bone density test. That one is mainly for osteoporosis. You want to still see how the bone is still retaining its calcium. So treatment is usually associated with pain. So pain relievers. Then sometimes you use braces to stabilize the spine. Physical therapies where you do all those massage for someone. You understand that kind of thing. Then sometimes you might actually want to do invasive surgeries like what? Vertebroplasty. Okay, they put a cement injection into the vertebrae to kind of like strengthen it. Then we have the kyphoplasty. Okay, we'll talk about all those high surgeries, okay, when we are back to the orthopedic series, okay, very soon. So surgeries is indicated if you have unstable fractures only. If you have done other conservative methods and they have not worked. So underlying cause, sometimes you have to manage what is actually causing the spinal fracture. If it is osteoporosis, try to handle the osteoporosis. If it is cancer, as you are handling the back pains or back fractures, you are trying to handle the cancer too. Okay, so I think that's it for the vertebral.